Can gum disease really lead to pancreatic cancer? Can depression show up before any physical symptoms? And is there a hidden link between diabetes and pancreatic cancer that most people don't even know about? Stay till the end, because these answers might genuinely save a life. Hello everyone, I'm Charlie. Over the last 10 years of my practice, I've had hundreds of patients and their families sit across from me asking the same questions again and again. Questions about what this disease actually is, why it's so hard to catch early, whether it runs in families, and what their real options are. I realized most of this information is either too technical or too scattered online. So today, I'm answering the 50 most commonly asked questions about pancreatic cancer. The exact questions my patients have asked me over a decade, all in one video. In this video, we'll go through everything, starting from what this cancer actually is, and why it's so hard to find early, to who's at risk, what symptoms to watch out for, how it's diagnosed, and what treatment looks like today. So before we dive in, I want to know a little about you. Drop a comment below and tell me, how old are you? Where are you watching from? And which problems you are facing? If your question isn't in this video, I'll answer it right here in the comments. Let's keep this conversation going. What is pancreatic cancer? Pancreatic cancer is basically when abnormal cells in your pancreas start multiplying out of control. The pancreas sits deep in your belly. It helps you digest food and keeps your blood sugar in check. When those cells go rogue, they form a tumor. And the tricky part is, it often goes unnoticed for a long time. Where is the pancreas located? Your pancreas is tucked away deep in your abdomen, sitting right behind your stomach. Because it's so hidden, even when a tumor starts growing there, it rarely causes obvious symptoms early on, which is one of the main reasons this cancer is so hard to catch early. What is the difference between exocrine and endocrine tumors? Think of your pancreas as having two jobs. The exocrine part makes digestive enzymes and sends them through ducts into your gut. The endocrine part makes hormones like insulin straight into your bloodstream. Exocrine tumors, especially a type called adenocarcinoma, are by far the most common and most aggressive. Endocrine tumors, or neuroendocrine tumors, are rarer and generally have a better outlook. What causes pancreatic cancer? There's no single clear-cut cause. What we do know is that it starts with DNA damage, mutations in your cells that make them grow uncontrollably. These mutations can build up over time due to aging, lifestyle habits like smoking, or they can be inherited. In most cases, it's a combination of factors rather than just one thing. Who is most at risk for pancreatic cancer? People over 50 are at the highest risk, especially those between 60 and 80. On top of that, smokers, people who are obese, those with a family history of the disease, and people with certain inherited gene mutations are all more likely to develop it. It's rarely a single factor. Usually, it's a combination. What role does age play? Age is actually the single biggest unmodifiable risk factor for pancreatic cancer. The vast majority of cases are diagnosed between ages 60 and 80. As you get older, cells accumulate more DNA damage over time, which raises the chances of one of those mutations leading to cancer. That said, it can happen in younger people too. It's just far less common. Does smoking affect the risk? Absolutely, and significantly. Smoking is linked to up to 30% of all pancreatic cancer cases. That's nearly 1 in 3. The toxins in cigarette smoke directly damage the DNA in your pancreatic cells. The good news is that quitting smoking does reduce your risk over time, so it's never too late to stop. Is obesity linked to pancreatic cancer? Yes, having a high BMI is a well-established risk factor. Extra body fat, especially around the belly, can cause chronic low-level inflammation and mess with insulin and hormone levels, both of which can encourage cancer development. Maintaining a healthy weight is one of the more practical things you can do to lower your risk. Does diet increase the risk? Diet does play a role. Eating a lot of processed meats, red meat, and refined carbohydrates has been associated with a higher risk. On the flip side, a diet rich in fruits, vegetables, and whole grains seems to be protective. It's not that eating a burger once in a while causes cancer, but consistent long-term dietary patterns do matter. How much does alcohol impact the risk? Alcohol itself isn't a direct cause, but heavy, long-term drinking can lead to chronic pancreatitis, ongoing inflammation of the pancreas, and that repeated inflammation over the years can promote the kind of cellular mutations that lead to cancer. Occasional or moderate drinking is generally not considered a significant risk factor. Is pancreatic cancer hereditary? In most cases, no. Around 90% of cases happen in people with no family history of it, but roughly 10% are tied to inherited genetic conditions. If you have multiple close relatives who've had pancreatic cancer, or if your family carries mutations in genes like BRCA1 or BRCA2, your own risk is meaningfully higher. Genetic counseling can be really valuable in those situations. What gene mutations are linked to it? Several inherited gene mutations can raise your risk, including BRCA1, BRCA2, PALB2, STK11, and CDKN2A. These are the same genes often associated with breast and ovarian cancer as well. If you carry any of these mutations, it doesn't mean you'll definitely develop pancreatic cancer, but it does mean closer monitoring might be a good idea. Does chronic pancreatitis increase the risk? Yes, it does. When your pancreas is constantly inflamed over many years, the repeated cycle of damage and repair creates an environment where DNA mistakes are more likely to accumulate. People with long-standing chronic pancreatitis have a noticeably higher risk compared to the general population. Can diabetes cause pancreatic cancer? It's a two-way relationship. Long-standing type 2 diabetes roughly doubles the risk of developing pancreatic cancer. But here's the tricky part. New-onset diabetes in an older, thin person who isn't the typical type 2 candidate can actually be an early warning sign that a pancreatic tumor is already developing. That's why any unexplained new diabetes in an older adult should be taken seriously. Do pancreatic cysts become cancerous? Most pancreatic cysts are completely harmless and never turn into cancer. But certain types, called mucinous cysts or IPMN, intraductal papillary mucinous neoplasms, do carry a real risk of becoming malignant over time. That's why doctors monitor them with regular imaging to catch any worrying changes early before they progress. Are some ethnicities more susceptible? There are slight differences. African Americans and people of Ashkenazi Jewish descent have somewhat higher rates of pancreatic cancer compared to other groups. For Ashkenazi Jewish individuals, this is partly explained by a higher prevalence of BRCA gene mutations in that population. Researchers are still studying all the reasons behind these disparities. Does gender matter? Men are diagnosed with pancreatic cancer at a slightly higher rate than women. Part of this is likely explained by historically higher rates of smoking among men. The gap has narrowed over the years as smoking rates have equalized, which actually supports the idea that lifestyle factors play a real role. Can environmental toxins cause pancreatic cancer? There's some evidence that long-term exposure to certain industrial chemicals and heavy metals, particularly in occupational settings, may slightly increase the risk. However, the data isn't as strong as it is for smoking or obesity. It's considered a possible contributing factor, especially in people who work in chemical manufacturing or certain industrial environments. Is there a connection between gum disease and pancreatic cancer? This one is actually pretty interesting. Several studies have found a statistical link between periodontal, gum disease, and an elevated risk of pancreatic cancer. The theory is that certain oral bacteria might trigger chronic inflammation that affects the pancreas. But this research is still in early stages. It's not confirmed as a direct cause yet, just an observed association. Can pancreatic cancer be prevented? You can't fully guarantee prevention, but you can meaningfully reduce your risk. Not smoking is the single biggest thing. After that, keeping a healthy weight, staying physically active, cutting back on processed meats and excessive alcohol, and managing diabetes properly all add up. If you have a strong family history, genetic testing and regular screening can help catch things early. What are the early signs of pancreatic cancer? Honestly, that's the most frustrating part of this disease. In the early stages, most people feel completely fine. The pancreas is so deeply positioned that a small tumor can grow for months without pressing on anything or causing obvious pain. By the time symptoms do appear, the cancer has often already progressed, which is exactly why it's caught late in so many cases. What are the common symptoms? The most frequently reported symptoms are upper abdominal or back pain, jaundice, which is yellowing of the skin and eyes, unexplained weight loss, loss of appetite, and digestive issues. The problem is that many of these symptoms are vague and can easily be mistaken for other, far less serious conditions, so they often don't set off alarm bells right away. What is jaundice? Jaundice is when your skin and the whites of your eyes take on a yellowish tint. It happens when a tumor in the pancreas, particularly in the head of the pancreas, blocks the bile duct, causing bile to back up into the bloodstream. It's actually one of the more recognizable warning signs, and people who develop it often get diagnosed earlier because it sends them to the doctor. Why does unexplained weight loss occur? Weight loss in pancreatic cancer happens for a few reasons at once. The tumor can suppress your appetite, so you're eating less. The damaged pancreas also stops producing enough digestive enzymes, so even what you do eat isn't being absorbed properly. And on top of that, the cancer itself consumes a lot of your body's energy. These factors together can lead to significant, rapid weight loss. How does the pain feel? The pain is typically described as a dull, gnawing, persistent ache in the upper abdomen that often radiates through to the mid-back. Many patients say it's worse at night or after eating a meal. It can feel somewhat different from a typical stomach ache, more deep and constant rather than sharp or cramp-like. This back pain element is something doctors specifically look out for. Can pancreatic cancer cause depression? Yes. And this is actually documented. Depression and intense fatigue are relatively common in people with pancreatic cancer, and what makes it more remarkable is that psychiatric symptoms sometimes appear before any physical symptoms are noticeable. Some researchers believe the tumor itself may release substances that affect brain chemistry. It's one reason why a sudden onset of depression in an older adult, especially alongside other subtle symptoms, shouldn't be dismissed. What changes in stool or urine indicate cancer? Because a tumor can block the bile duct, bile stops reaching the intestines and ends up in the blood instead. This causes the stool to turn pale or clay-colored, and it may float because it's greasy and full of undigested fat. Your urine, on the other hand, becomes dark brown, almost tea-colored, because excess bilirubin is being excreted through the kidneys. These changes, together with jaundice, are a strong signal to get checked out. Does pancreatic cancer cause blood clots? Yes, people with pancreatic cancer have a significantly higher chance of developing blood clots, including deep vein thrombosis in the legs and pulmonary embolism in the lungs. In fact, some patients are first diagnosed because they show up with an unexplained blood clot. The cancer releases substances that make the blood more prone to clotting. Why is it hard to diagnose early? Two main reasons. First, the pancreas is buried deep in the abdomen, surrounded by other organs, so a growing tumor doesn't push on anything nearby for a long time. Second, the early symptoms, vague abdominal discomfort, mild digestive issues, fatigue, are incredibly common and rarely make someone think, this could be cancer. There's also no reliable routine screening test available for the general population the way there is for colon or breast cancer. When should I see a doctor? You should see a doctor without delay if you notice yellowing of your skin or eyes, unexplained and significant weight loss, or persistent pain in your abdomen or back that doesn't have an obvious explanation. If you develop new onset diabetes without the usual risk factors, that's also worth discussing with your doctor. Trust your instincts. If something feels persistently off, don't wait it out. What diagnostic tests are used? Doctors use a combination of tools. Imaging tests like CT scans, MRIs, and PET scans give a picture of the tumor's location and size. An endoscopic ultrasound, or EUS, lets doctors get a very close-up look at the pancreas and take a tissue sample. Blood tests can also check for tumor markers. Usually, multiple tests are used together to build the full picture. What is an endoscopic ultrasound? EUS. An EUS is a procedure where a doctor passes a thin, flexible tube with a tiny ultrasound probe at its tip down through your mouth and into the stomach and small intestine. From there, they can get very detailed images of the pancreas, much sharper than a regular CT scan, because the probe is right next to it. They can also use the same instrument to guide a needle and collect a tissue sample for biopsy. Are there blood tests for pancreatic cancer? Yes, the most commonly used one measures a protein called CA19-9. Elevated levels can indicate pancreatic cancer, but it's not a perfect test. Some people with the disease have normal levels, and some people with elevated levels don't have cancer at all. It's more useful for monitoring how a known cancer is responding to treatment, rather than as a standalone screening tool. What is a CA19-9 test? CA19-9 is a protein that pancreatic cancer cells tend to shed into the blood. A blood test can measure how much of it is present. A high reading can raise suspicion for pancreatic cancer, and doctors often track it over time to see if a tumor is growing or shrinking in response to treatment. But because it's not perfectly accurate on its own, it's always used alongside imaging and other tests. How is staging determined? Staging is determined by looking at the imaging results, mainly CT scans and MRIs, to assess how large the tumor is, whether it has grown into nearby blood vessels or structures, and whether cancer cells have spread to distant organs like the liver or lungs. Staging essentially answers the question, how far has this gone, and what are our options? What are the stages of pancreatic cancer? Pancreatic cancer is staged from 0 to 4. Stage 0 is the very earliest, where abnormal cells are present but haven't invaded surrounding tissue. Stages 1 and 2 involve a tumor confined to or near the pancreas. Stage 3 means it has grown into nearby major blood vessels or lymph nodes. Stage 4, the most advanced, means it has spread to distant organs like the liver or lungs. Unfortunately, most people are diagnosed at stage 3 or 4. What are resectable and unresectable tumors? A resectable tumor is one that surgeons can actually remove. This is possible when the tumor hasn't grown into the major blood vessels that supply the area and hasn't spread to distant organs. An unresectable tumor, on the other hand, is too close to or has already invaded critical blood vessels, making safe removal impossible. This distinction is crucial because surgery is the only real chance at a cure. What is locally advanced pancreatic cancer? This refers to a tumor that has grown into nearby structures, typically major blood vessels around the pancreas, but hasn't yet spread to distant parts of the body. It's not technically resectable in the traditional sense, but it's also not fully metastatic. Treatment often involves chemotherapy and sometimes radiation, with the hope of shrinking the tumor enough to potentially operate later. What is metastatic pancreatic cancer? Metastatic means the cancer has left the pancreas and traveled to other organs, most commonly the liver, but also the lungs or the lining of the abdomen. At this point, surgery is no longer an option for curing the disease. Treatment shifts to managing symptoms, slowing the spread, and trying to extend life as comfortably as possible. Is a biopsy always necessary? Yes, always. A biopsy is the only way to get a definitive diagnosis, to actually look at the cells under a microscope and confirm they're cancerous. Imaging can strongly suggest cancer is present, but before any specific treatment like chemotherapy or targeted therapy can be started, you need that microscopic confirmation. It also tells doctors what type of cancer it is, which affects treatment decisions. What are the main treatment options? The main options are surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. Which ones are used depends largely on the stage of the cancer and the patient's overall health. For early-stage cancers, surgery is the primary goal. For advanced cancers, chemotherapy is the backbone of treatment, sometimes combined with radiation. Targeted therapies and immunotherapy are newer additions used in specific cases based on the tumor's genetic profile. What is the Whipple procedure? The Whipple procedure is a major surgery typically used when the cancer is in the head of the pancreas. During the operation, surgeons remove the head of the pancreas, part of the small intestine, the gallbladder, and the bile duct. Then reconnect everything so the digestive system can still function. It's one of the more complex surgeries in all of medicine, but it can be curative in patients where the cancer is caught early and fully removed. Is surgery a cure? Surgery offers the best shot at a cure, but it's only an option for a relatively small percentage of patients, those whose cancer is found early enough and hasn't spread. Even after a successful surgery, the cancer does come back in many patients, which is why chemotherapy is often given after the operation as well. Long-term survival after a Whipple procedure is possible, but it requires a combination of a successful surgery and follow-up treatment. What is the goal of chemotherapy? Chemotherapy serves different purposes depending on the stage. Before surgery, it's used to try to shrink the tumor and make it easier to remove. After surgery, it aims to kill off any remaining cancer cells that might be lurking. For patients with advanced, inoperable cancer, chemotherapy is the main treatment. The goal shifts to controlling the disease, managing symptoms, and extending life. What is targeted therapy? Targeted therapy is a more precise approach than traditional chemotherapy. Instead of attacking all rapidly dividing cells broadly, targeted drugs zero in on specific proteins or gene mutations that are driving the cancer's growth. For example, patients with BRCA mutations may benefit from drugs called PARP inhibitors. Targeted therapy is generally better tolerated than chemotherapy, but it's only effective when the tumor has the specific mutation the drug targets. What are clinical trials? Clinical trials are research studies testing new treatments, new drugs, new drug combinations, or completely novel approaches in real patients. For pancreatic cancer, where the existing options are limited, clinical trials can be a genuinely valuable option. They give patients access to the most cutting-edge treatments before they're widely available. Oncologists can help evaluate whether a patient might be a good candidate for any ongoing trials. How is pain managed? Pain management is a big part of pancreatic cancer care. Mild to moderate pain is typically handled with oral pain medications, starting with over-the-counter options and escalating to opioids when needed. For severe, hard-to-control pain, doctors can perform a celiac plexus block, an injection that numbs the nerve cluster near the pancreas. Radiation therapy can also help reduce pain caused by the tumor pressing on surrounding structures. Are dietary changes needed after treatment? Often yes, especially after surgery. If part or all of the pancreas is removed, it can no longer produce enough digestive enzymes, meaning food isn't broken down properly. Patients typically need to take enzyme replacement pills with every meal. Many also develop diabetes after surgery because the insulin-producing cells are affected. A dietitian becomes an important part of the care team, helping patients navigate what and how to eat for the best quality of life. What is the outlook for pancreatic cancer? The honest answer is that survival rates are still quite low compared to many other cancers, primarily because the disease is usually found at an advanced stage when treatment options are limited. That said, outcomes are meaningfully better for those diagnosed early, Patients who have successful surgery for stage 1 cancer have a much better prognosis than those diagnosed at stage 4. Research is actively ongoing, and new therapies are improving outcomes year by year. So there is real reason for hope. And those were all 50 questions, every single one that patients and their families have asked me in the last 10 years. I hope this video gave you some clarity, because I truly believe that when it comes to a disease like this, being informed is the first and most powerful step. Pancreatic cancer is difficult. It's not easy.